I'd like to begin by thanking the UN Science Summit Youth Parliament for giving me this incredible opportunity to present my work on dry eye research and how it directly contributes to SDG. I'm excited to share with you two major projects I've developed that address one of the most common yet overlooked global health issues, dry disease. So before I begin, I want to ask you all a question. How many of you have heard of dry disease? Wow. It seems many of you are unfamiliar with it, and that's part of the challenge. Dry disease is often overlooked, yet it impacts over 800 million people worldwide. That's 12% of the global population. And to put that into perspective, around 16 million Americans are affected. So dry disease may sound minor, but it impacts people's lives significantly. It can lead to symptoms like dryness, redness, and burning in the eyes. And in severe cases, it can lead to worriness, it can lead to sensitivity to light and sharp pain in the eyes. And the problem, this can be, imagine not being able to read, drive, or perform everyday tasks comfortably due to your vision. This problem is particularly pressing among seniors and low to middle income communities where access to eye care is often limited. With the increasing use of contact lenses and electronic devices, the prevalence of dry disease has soared. However, there's no effective treatment, so early diagnosis is the key. And that's where my work comes in. So back in 7th grade, I started developing a low-cost point-of-care diagnostic tool for the early detection of dry disease. I transformed my garage into a small lab space where I could experiment and innovate. This project became especially crucial during the COVID-19 pandemic, with the increasing reliance on electronic devices, which led to a surge in dry cases. I'm sure many of us have used those COVID-19 testing kits. My first project was actually based off these types of tests. I created a paper-based lateral assay that detects lactoferrin and interleukin-6, key biomarkers for dry disease. After several rounds of tests, after hundreds of testing in my garage lab, I successfully developed a test that can detect nanogram levels of these biomarkers. By offering a simple yet affordable test, especially in communities that lack these advanced medical technologies, my project directly contributes to SDG. I'm proud to say that my results were published in the Biophysics and Biochemistry report in 2022, peer-reviewed and first author. I had the honor of presenting my work at the National Eye Institute's Eye in the Future recognition event. My journey didn't stop there though. Considering the difficulties of collecting tear samples for diagnostics, I thought, what if we use a technology that nearly everyone has access to, such as a smartphone? And so that's where my EyeScore app was born. So EyeScore is a smartphone app that uses facial recognition to count eye blinks, a critical biomarker of dry disease. It uses a simple questionnaire that allows patients to get a 10-point eye healthiness score, similar to a BMI or heart rate for your eyes. So here's how, this looks like a really busy slide. I won't get too detailed, but these are the algorithms behind how my app counts blinks. I don't want to get too detailed, so essentially it just recognizes the eyes and measures the distance between the eyelids to count blinks effectively. So in order to effectively test the effectiveness of my app, I ran it on 10 videos of healthy individuals and 10 videos of dry patients diagnosed by an eye doctor. You can see here that all 10 dry patients were identified by my app. What was surprising, however, was that 3 of the normal individuals were identified as having mild dry disease. After an eye examination with an eye doctor, these individuals were confirmed to be having pretty dry disease. This app is designed to bridge the gap in healthcare issues by giving underserved communities the ability to monitor their eye health and send the results directly to their eye doctors, all from their smartphones. They're aligning directly with SDG3. After clinical testing, my results were published in the Journal of Clinical Medicine in 2023, and I was proud and I was honored to receive the Best Abstract Award at the 2023 American Association for Clinical Chemistry. So in order to expand the outreach of my innovations, I founded a 501c3 nonprofit company called VisionCure, and it focuses on eye care solutions for people of all ages. My team has been hosting eye care education events at local senior centers where we demo the app and share tutorials. The response from the community has been overwhelmingly positive. I'm also working on an EyeScore 2.0, which will include multilingual support for people who speak Spanish and Chinese to better serve the non-English speaking population. Soon I'll be releasing this app on the Apple App Store so even more people on a global level can access this vital tool. As I wrap up, I want to leave you with this thought. Good vision is key to living a good life, and addressing preventable diseases like dry disease is essential to achieving SDG 3. I invite you to visit the VisionCure website at visioncure2020.org and read my papers on MVPI and Elsevier. Together we can build a brighter and better future